I am State Senator Maddie Hunter, the lead sponsor of House Bill 158, also known as the Healthcare and Human Services Pillar, the final piece of the Legislative Black Caucus plan to eradicate racism in the state of Illinois. For this country's entire existence, Black people have been disrespected, abused, and misused in the healthcare system. There is a substantial amount of research that proves racism is the root of various health inequities experienced by Black Americans to this day. The Illinois Healthcare and Human Services Reform Act serves as a part of a larger conversation in Illinois surrounding diversity, equity, and expanding the way we care for our communities. This act was an important step to remedy the wrongs of the past and address the plethora of issues, including access to health care, hospital closures, managed care organization reform, community health care certification, maternal and infant mortality, mental and substance abuse treatment, hospital reform, and medical implicit bias. In particular, Representative Lilly and I knew we needed to include community health workers in this legislation, as they are a vital part of the healthcare industry. Community health workers are essential to improving individual and community health. They help build trust and relationships and deepen communication between patients and providers. More so, community health workers have a deep understanding of their communities through lived experience, which makes them more uniquely qualified to address the social and the behavioral determinants of health. The livelihoods of all Illinoisans, no matter what race, gender, sexuality, ability, or socioeconomic status, are fully supported in this act. Healthcare is a right. If healthcare is not centered on the needs of patients, then it is not serving its true purpose. I have believed that in my entire life and have fought for legislation like this my entire career as a state senator. And it feels surreal to be able to see this kind of package come to fruition. I'd like to thank all of the Roundtable participants for their involvement, and I'm happy to come together to support and promote the access of community health workers and access to health care as a whole.
Hello, I'm State Representative Camille Lilly here in the state of Illinois, and I'm so happy to join you all on this roundtable to learn a little bit more about what's going on here in Illinois around healthcare. I and Senator Hunter are both champions, if you will, of if you don't have your health, you don't have much else. And when we came to deal with the fourth pillar of the Illinois Legislative Black Caucus, it was about creating access and better health outcomes. And so it was exciting because the roundtable you're going to experience today was pretty much kind of the process that we use to get input from all around the state professionals, health professionals. And we did a subject matter hearing with professionals, and we invited all of our colleagues to listen to how we can create better access and better health outcomes. The Illinois Legislative Black Caucus, unfortunately, took up this mantle because of a devastating incident that occurred in Minnesota with Mr. Floyd, and that tragedy of his death. But it was coupled with COVID-19, where so many Black and brown and poor people were not surviving the virus, the pandemic. And then it was coupled with, the essence of racism that exists in our society, and a lot of people just don't know. So it became an opportunity to educate, to increase access, and to bring people together to work together to fight for better health outcomes and quality of life in our communities. We built it on essentials. You have some basic essentials in a society that makes you successful, from education to healthcare to food to jobs. All of those basics allows you to be healthy. And this particular legislation addressed so much of that. I'm making sure hospitals remain open. In the middle of the pandemic, hospitals were closing, but we needed the hospitals to save the lives of the people who were finding themselves with COVID, and then hospitals were closing. So we put a moratorium on closing the hospitals during a pandemic. But the hospital said, we're gonna close. So these kinds of decisions, for whatever reason they are making them, were important to address in our pillar. And that's one of many: implicit biases, cancer, access to cancer treatment and education. The mere fact that women today, particularly Black and brown women, are not surviving their delivery, and their children are surviving their first birthday. These are the types of issues that your neighbors and you, or you may know someone that were struggling with, and in Illinois wanted to address them. Again, I would like to say thank you for participating on today. Your experience is going to allow you to share. Your experience is going to allow you to come up with ideas that's going to make a difference in the lives of people you know and in people you don't know. So please be open to being the solution. And that's basically how we got it done here in the state of Illinois to improve health outcomes. We have more to do, but this roundtable is going to help us. So again, thank you for joining on today.
Good afternoon, and I would like to welcome you to a roundtable discussion. My name is Letitia Boughton Price. I am the president and CEO of the Illinois Community Health Worker Association. I have been in this work for over 20 years and love what I do. I love to elevate people, and in this case, community health workers. I would also like to share with you my colleagues for today, Jacob Hakar and Ali Nazari, students from the Center for Health Law and Policy Innovation of Harvard Law School. And they will provide details about the bill and what to expect at the roundtables. Let me share some additional background information. ILCHWA is a membership organization made up of community health workers, promotores de salud, allies, and supporters across the state of Illinois and beyond. We envision ourselves as the unified voice for CHW statewide with a 5-pillar mission to advocate, amplify, serve, promote, and address the needs of the CHW workforce. CHILP advocates for legal, regulatory, and policy reforms in health systems with a focus on the health needs of systematically marginalized individuals. The purpose of our roundtable meetings is to focus on the Illinois Healthcare and Human Service Reform Act, Public Act 102-004, and the opportunities that this new legislation offers to improve funding for and access to community health worker services. The plan is to have a guided discussion where we get your feedback on how this law can be best implemented. Based on input received from these virtual meetings, ILCHWA, along with CHILP, will provide recommendations to state officials on how to implement this law in a way that best supports the CHW workforce and the communities they serve. The purpose of this video presentation is to get everyone prepared for the roundtable meeting and have a shared understanding. So the agenda for the presentation is a short background of the House Bill 10158, How does this impact community health workers? Why is your participation crucial? And then what will happen during these roundtable discussions? Jacob and Ali will assist in that discussion. What is House Bill 158, which passed in 2021? It recognizes and expands the role of community health workers. It provides funding to reduce infant mortality among disadvantaged and racialized communities. It enhances coordination of safety net hospitals. It changes the appointment process for health commissions, resulting in more representatives from the communities that they serve.
So what does HB 0158 do for community health workers? The bill expands the role of community health workers in the healthcare system through 3 initiatives. First, the bill calls for the creation of a certification process for training programs serving community health workers. The Department of Public Health will work with the Illinois CHWA to adopt a certification process for programs run by community organizations. The department will also work with educational institutions to certify class-based programs. Second, the bill directs the Department of Public Health to establish a Community Health Worker Certification Board in collaboration with the Illinois CHWA. The board will oversee the certification process used by community health workers and the certified training program serving them. Third, the bill enhances the reimbursement process for community health workers. Subject to the federal government's approval, the Department of Healthcare and Family Services will develop 2 Medicaid reimbursement processes for certain services, such as care and diagnosis coordination. Community health workers may receive direct reimbursement if they are certified and work under the supervision of providers enrolled in Medicaid. Additionally, Medicaid managed care organizations may, at their discretion, employ or reimburse community health workers regardless of their certification or supervision status. So, why is your participation crucial? Because the bill's rollout is still in its early stages, your comments will be a crucial component of how it will be rolled out. To this end, roundtables are being held with fellow community health workers across the state. This feedback will be sent to state agencies so that they can use it to improve this bill's implementation.
What will you do during the roundtable? The roundtable will start with a discussion about certified training programs. This may include training format and content, issues that prevent people from participating in training programs, and examples of local training programs that have worked well. Next, roundtable participants will discuss community health worker certification. Examples include certification requirements as well as whether multiple types of certification should be offered. Then there will be a discussion about the support that current community health workers will need and any issues that may stop other members of your community from pursuing certification. Finally, the roundtable members will discuss the reimbursement model. For example, you can discuss how MCOs, that is managed care organizations that administer Medicaid, can better use the expertise of community health workers by hiring them or reimbursing them for their services. Also, the roundtable will focus on how community health workers can receive direct Medicaid reimbursement. Relevant issues that you might want to discuss include who can serve as Medicaid enrolled supervisor and services that should be covered. Thank you again for taking the time to watch this presentation and for agreeing to join us in the upcoming roundtable on HB 0158. We will keep you updated on the bill's rollout. Please watch out for an invitation to a webinar where we will discuss the bill's key takeaways for your daily work, as well as how you can get more involved with Illinois CHWA. Please feel free to contact the Illinois CHWA or the Center for Health Law and Policy Innovation if you have any suggestions or questions. We look forward to meeting you at the roundtable.